Hello, my name is Rylie Haupt and I'm a nursing student at Glacier Hill Senior Living. I'm here today to present a patient. Patient is an 88-year-old Caucasian female who is married for over 50 years but has been a widow since 1996. Her former job was as a school librarian and now expresses her love of books through reading as a retired adult. Patient was admitted into Glacier Hill's Rehabilitation Center on March 11, 2014. Patient was admitted into the center to receive aid in her recovery after completing an aortic valve replacement through cardiac catheterization. While rehabilitating, patient hopes to regain strength and decrease fatigue. Before being diagnosed with aortic stenosis, patient complained of constant diminished energy and loss of strength. Patient has fought a lifelong battle against numerous cardiac diseases such as hypertension, atrial fibrillation, and the stated aortic stenosis. Other symptoms associated with patient's heart conditions include shortness of breath, fatigue, nausea, poor blood circulation, and insomnia. Alleviating factors include valve replacement surgery, the use of oxygen, and I quote, taking a rest. In patient's efforts to soothe symptoms, she has changed her diet to avoid sodium and developed a new sleeping pattern. When asked about the pain associated with her chief complaint, patient describes it as almost negligible. When asking patient how she perceives the problem at hand, she answers very optimistically. I'm feeling good. I've known that it's been a problem for a while, and I've done my best to fight it. I may be weak now, but I can't wait to see how the surgery changes my life. When taking vital signs on patient, the following were recorded. Heart rate, 72. Respiratory rate, 18. Blood pressure, 150/87. Temperature, 36 degrees Celsius taken orally, and pain stated as negligible by patient. Next, we will review the patient's health history. Patient was diagnosed with breast cancer in 1999, but since the cancer has been defeated by both surgery and radiation therapy. She also had glaucoma of the left eye. All patients' immunizations are up to date and her allergies are limited to penicillin, sulfa, and the basic seasonal irritation. Patient claims that the most recent hospital visit was 10 years ago to treat an infected wound on her leg. Patient takes many medications to treat the problems that she is facing. To treat her glaucoma, patient uses medicated eye drops such as latanoprost and bromonidine daily in her left eye only. Patient is administered 2 milligrams of Coumadin, an anticoagulant, orally per day. This medication is checked every 2 weeks to be adjusted as seemed fit. Patient is also given 75 milligrams of the antiplatelet Plavix orally per day to keep her blood from thickening. To keep patient's heart rate and blood pressure in a manageable range, she is given oral doses of 50 milligrams of eteriladol and 5 milligrams of lisinopril, an ACE inhibitor, daily. In hopes of treating patient's restless legs, she is given 2 milligrams of ropinirole every day before bedtime. 650 milligrams of Tylenol is given orally every 6 hours, along with 700 milligrams Lidocaine that is applied to patient's back every day. Both are used as pain treatment as needed. Patient is also given 25 to 50 grams of tramadol orally every 6 hours to treat abnormal excruciating pain. Because patient suffers from severe edema of the lower extremities, she is given diuretics. Patient is given 40 milligrams of Lasix orally a day, which is supplemented with 10 milliequivalents of potassium to replace the loss due to diuretic. Patient is also given 25 milligrams of hydrochlorothiazide orally per day to act as a diuretic. In her efforts to avoid acid reflux, patient is administered 20 milligrams of Prilosec every morning. Senna, Colace, Miralax, and Dulcolax are all given as stool softeners to help treat patient's constipation. Patient uses an inhaler prescribed with 18 milligrams of tiotropium bromide administered every day to ease her efforts of breathing, along with 50 micrograms or 2 sprays twice a day of fluticasone, otherwise known as Flonase, to treat congestion due to allergies. To maintain healthy bone mass and avoid vitamin deficiency, patient consumes 250 milligrams of vitamin C, 400 units of vitamin D, and 70 milligrams of alendronate. The alendronate is given to prevent further osteoporosis that comes with aging. Lastly, to treat patient's depressive symptoms, she is given 37.5 milligrams of venlafaxine daily in oral form. When looking at the patient on a functional level, she is very conscious about her health. Patient states that she only consumes alcohol on special occasions and admits that she is not great at exercising. When asked to elaborate, she stated that she walks about 30 minutes a day and sometimes uses the bike in the workout room. She explains that she has had irregular insomnia for many years but does not have medication prescribed because she does not consider it to be a problem. When asked about how she felt about her nutritional status, she answered with, "Excellent." Patient has been a vegetarian for over 2 years and has been working to minimize sugar and salt in her diet, especially since the time of her surgery. Patient smoked for over 25 years but quit more than 50 years ago. She consumes minimal caffeine through tea and coffee and denies drinking any soda at all. When asking about mobility, patient explains that she is completely dependent on a walker and that limited mobility is her biggest concern after surgery. She continues to walk the halls of the rehabilitation center to build endurance. Patient was more than willing to discuss her family life in regards to her psychosocial data. Patient claims that her 3 children, 15 grandchildren, and 5 great-grandchildren are all very supportive, especially in her time of need. Although patient misses her deceased husband, she focuses on the 50 years of marriage instead of the 18 years that she has been a widow. Patient believes in a higher power but does not follow a formal religion. She earned a master's degree from the University of Michigan and still expresses her Wolverine pride. Go Blue. Overall, patient takes very good care of herself despite her old age. When exploring patient's family history, it can be concluded that most of patient's conditions seem to be genetic. The family has an unfortunate past associated with hypertension and atrial fibrillation. Patient explained that her mother died of heart failure and her brother and son suffer the same fate of a life filled with atrial fibrillation. Beyond cardiac problems, cancer is also very prevalent. Patient herself battled breast cancer, patient's son fought colorectal cancer, and patient's brother defeated stomach cancer. When I collected subjective history data, I focused on 2 systems that are of high priority for this patient. I chose cardiac and peripheral vascular systems. When completing the cardiac assessment, patient attested to no chest pain, arm numbness, or jaw numbness. As previously stated, patient has a long family history of heart disease and hypertension. Fortunately, patient clarified that there were no murmurs present and that, to the best of her knowledge, there was an absence of palpitations. Patient seemed to experience increased fatigue before and after surgery, but it is slowly recovering. When asked about sleeping patterns related to her cardiac diagnosis, she explained that she had no difficulties lying flat, but uses 2 pillows to sleep comfortably. When doing a physical examination on patient's cardiac system, findings were as expected. Upon inspection, shortness of breath and fatigue were obvious. Luckily for patients, heaves and lifts were absent from 5 key areas, and the contour of the chest was roughly symmetrical. When palpating the patient, I was glad to see that there were no lifts or thrills present. However, because of her atrial fibrillation, she did possess a rapid, irregular heartbeat among the 5 key areas and the point of maximal impulse. During auscultation, it was not surprising to find irregular heartbeat heard by both the bell and the diaphragm. As the patient suggested, there were no murmurs auscultated. However, it should be noted that it was difficult to differentiate heart sounds because of the irregularity of the atrial fibrillation. If I would have assessed patient before surgery, it was highly probable that I would have auscultated murmurs, indicating the valve malfunction that was fixed during surgery. When assessing the peripheral vascular system, patient expressed no pain in legs, calves, thighs, or hips while walking. It is noted that patient has severe pitting edema in lower extremities characterized by coolness, hair loss, and varicosities. Patient expresses that her varicose veins may be the reason for her frequent blood clots that occur every few years. When palpating patient's lower extremities, her legs lacked warmness and equal hair distribution. The skin also displayed a hard and gelatinous texture, while capillary refill proved to be normal on fingers, but abnormal on toes. All of these factors, along with the amount of fluid buildup present in patient's legs, graded patient's edema as a +3, otherwise known as severe. Upon palpating patient's pulses, the following results were documented. Temporal, +3 bilaterally. Carotid, +4 bilaterally, 1 at a time. Brachial, +3 bilaterally. Radial, +3 bilaterally. Femoral, +2 bilaterally. Popliteal, posterior tibial, and dorsalis pedis were all unable to be assessed. As you can see by the decline in pulse strength, the patient's edema is so severe in the lower extremities that I was unable to feel a palpable pulse below the central femoral arteries. Based on my patient's high blood pressure and cardiac disease, I found it pertinent to investigate HEAT, head, eyes, ears, nose, and throat or thorax. According to the British Journal of Ophthalmology and the U.S. National Library of Medicine National Institute of Health, it's important to assess these areas because there's a high likelihood of the co-occurrence between hypertension and glaucoma. Glaucoma, a leading cause of blindness, occurs when fluid buildup in the eye puts pressure on the optic nerve, eventually cutting off circulation altogether. As you can probably conclude, chronic hypertension increases internal pressure and could potentially be the reason for my patient's left eye glaucoma. Now, if we look at this chart, you can see that any systolic blood pressure above 120, there's an increased likelihood for open eye glaucoma. Again, on this chart, you can see that as the systolic blood pressure gets above this 120, there's this drastic increase and prevalence of occurrences of open eye glaucoma. So lastly, when choosing a system that is pertinent to my patient's condition, I decided to evaluate the thorax, lungs, and breasts. When asking my patient about the origin of her cardiac diagnoses, she explained that the doctors confusingly mistook her condition as COPD. This is because there are many similar symptoms and contributing factors between the two conditions. According to the National Heart, Lung, and Blood Institute, it is important to perform a respiratory assessment on my patient because there's a strong correlation between respiratory diseases such as pleural effusion and hemothorax and cardiovascular disorders. In the instance of pleural effusion, excess fluid builds up in the pleural space. This extra fluid can push the pleura against your lung until it collapses, making it harder for the patient to breathe. Pneumonia, heart failure, cancer, or pulmonary embolism can all lead to pleural effusion. Hemothorax, or blood buildup in that same pleural space, also puts pressure on the lungs, leading to eventual collapse and possible shock. This shock is characterized by insufficiency of blood and oxygen to vital organs in your body. An injury to your chest or heart surgery, or lung or pleural cancer can cause a hemothorax, again explaining why this assessment would be pertinent to my patient.